The medial knee pain means when the person is having pain in this inner side. Then how can we treat this pain? Very quickly, immediately. So number one, we have to add all the points on the opposite side. So we'll start one by one. First, we are putting this point, then we are putting second point, then third point over. We can put this point, either this point or this point, any one point. Points are very simple, but effectiveness is very high. Medial knee pain. The 77.16 means 77.17 means spleen 9. This is the first point. First point, 77.17 or spleen 9. This is the first point. You can see here. It's a very easy to find out. The person is suffering with a knee pain in the right side. The medial knee pain. Medial knee pain means this inner side. This is the medial. This is the frontal, and this is the medial knee pain. Then the first point will be spleen 9 on the opposite side. So this is my leg at the opposite side. So where is the spleen 9? I can feel the bone. This is the tibia bone. I can feel the border of the bone. This border is spleen meridian. I am reaching on the uppermost part. Okay, I reached on the uppermost part. This is the uppermost part. After that, there is no depression. After that, there is a bone, no depression. So this is the uppermost part of the depression. So I will take one needle and I will be putting here. I can put the 1 needle without any problem here. You can see. This is my first needle, spleen 9 on the opposite side. In the Master Tung Acupuncture, spleen 9 has been considered as a very good point. That is called Heaven Emperor. Then the second needle will be 44.06. If you want to put this needle first, then that means no problem. 44.06 and spleen 9. As soon as you put the spleen 9, it starts working on the medial knee pain. And we already know 44.06 point is a special point for the medial knee pain. Now the third point and the final point. So this is the first point. Then the second point. And the third and the final point, that is called small intestine 1. Small intestine 1 is great point for knee pain. I have tried this point. Even we can see wonderful result with only 1 point. Small intestine 1. If the person is having the pain because of the rheumatoid arthritis, the knee pain, we can treat only with a single needle. So this is the location of SI1. We know in the small finger, the small intestine meridian is starting from here. That is the location of SI1. Even we can put the sujog needle, a smaller needle. If the person is complaining you the knee pain on the medial side, you can try this point on for some patient, only single point. You will see the patient will tell you, I'm feeling good, much better. And one more thing I would like to tell you, SI1, one of the great point, Master Tung has told one story about this point. Master Tung inserted this needle to one lady for the knee pain. As soon as master Tung inserted this needle, because we know SI meridian is having effect on the heart meridian, because SI is the couple of heart. Am I right or not? SI is the couple of heart. Second concept. Just I told you few minutes back, there is a very deeper relationship of the Tai Yang with the Tai Yin. If you treat the SI, it will work on the spleen. If you treat the lungs, it will work on the UV. So as soon as I put needle on the SI1, definitely it is working on the spleen. What is a spleen? A spleen means cough. A spleen means phlegm. A spleen means humidity. A spleen means toxin. So Master Tung has inserted one needle to one lady on the SI1, because SI is having connection with the spleen, with the turbidity, dirtiness, phlegm. SI also having connection with the heart. As soon as needle, the lady has vomited one bowel cough, because she was having lots of phlegm on the heart. She was having too much heaviness in the heart, some uneasiness in the heart, some discomfort in the heart, but which were not visible. Like sometimes we are telling, oh, I'm not feeling good. It's not visible. It's not coming in any report. It will not come in CT scan, MRI. If you're not feeling good, you're not feeling good in your heart. It will not come in report. But as soon as you put the SI1, it will remove the unwanted cloud phlegm from the heart. Why? Because SI will work on the spleen, means phlegm, as well as on the heart. It will remove the phlegm from the heart. Heart will be cleared. So your knee will be clear. So SI1 has, as soon as Master Tung inserted this needle to lady on the SI1, she spitted too much cough, one bowel cough, and after that she became very relaxed and comfortable. So you can try this point for the patient having too much heaviness in the heart, after fighting, after quarreling with someone. So the lady was having quarrel with her husband, and after that quarrel, she got too much heaviness in the heart, and just with a 1 point SI1, she got very good results. So when the person is having pain on the knee, we can treat with the SI1 single point. As per the Master Tung, this is 11.16. So this explanation is given in the 10 balance method, that how can we treat SI1, and while treating the SI1, how can we remove the phlegm? So SI1 will be third point. So the person is suffering with a knee pain in the medial side. So first point will be spleen 9. Spleen 9 is also a very good point, who will remove the phlegm. The second point 44.06. And the third point will be SI1 or the 11.16. These 3-point combination, we have to put all the 3 points on the opposite side for the medial knee pain. Sometimes we can replace the SI1 with another point, that is 11.09. Okay, 11.09. So we can choose protocol 77.17, 44.06, and 11.16 or SI1. The spleen 9. We can replace this point with the 11.09. Other 2 points are same. 11.09 is very simple point. We can see in this image, in the middle finger. This point is located in the middle phalanges bilateral on both the sides. That is called 11.09. This point is very good point for the medial knee pain. Those who are doing master Tung, those who are practicing master Tung acupuncture, they know the effectiveness of this point. See, this is the middle finger. Middle finger is the finger of pericardium. Am I right or no? Middle finger is the finger of pericardium. Pericardium meridian is coming here. Am I right? So when you are treating the middle finger, it's a wonderful finger for pericardium, for heart. And suppose if you do the imagination of whole body, upper body means head, we can tell head, chest, abdomen. If I'm putting the two needles on the both side, this is called a heart knee because this is the chest area, head area, chest area, abdominal area, head, chest area. If I'm putting two needles bilateral here on the side of the bone, on the side of the bone, exactly in the center. Ultimately, I'm treating the chest area. Ultimately, I'm treating the heart. So this is called heart point, or the another name of these point, heart knee, because they are the point of heart working on the knee. The number is 11.09. Either I can put SI1 or I can put 11.09. Any one point I can choose. So 77.17 or spleen 9, 44.06. Then, so look at here, all the points already there. So the point number 1, 77.17 for medial knee pain, for this medial knee pain. This pain is happening on the inner side or the medial side. Spleen 9. The second point will be 44.06. And the third point, either SI1 or this hard knee point, 3-point unit for medial knee pain. And remember these 3 points because most of the people are suffering with the pain in the medial knee. Initially, when some patient will come to you, the pain is very too much. And if you ask, can you tell me where is the pain? Inner side, medial side, lateral side, frontal side, back side. Because pain is too much, patient is telling, I don't know. Pain is all around. As you are doing two treatment, one treatment or two treatment or three treatment, then patient will tell you, oh, now my pain is on the medial side. Because the real pain is in the medial side only. But when the pain is spreading, first pain is started from the medial side, then the muscles around, the ligament around, all the structure around also are involved. Then pain is all around. Patient is not able to understand where is the pain exactly. Then patient is telling, okay, I have pain, knee pain, pain all around. Then when you are doing 2-3 treatment, then patient will tell you, now my pain is on the inner side. Now the pain will reach on the right place, and even sometime it might happen after a few more sitting, patient will tell you, doctor, there is no knee pain, but now I have back pain, because knee pain was because of the lower back. And remember one thing here, this knee pain is because of the lumbar 4 vertebra. This knee pain because of the lumbar 5 vertebra. I will repeat again. Lumbar 3, lumbar 3, lumbar 4, lumbar 5. I will repeat again. The medial side knee pain because of the lumbar 3 vertebra. The front side pain because of the lumbar 4 vertebra. The lateral side pain because of the lumbar 5 vertebra, and the back side pain because of the S1. So knee pain will disappear. Now patient will tell you, doctor, my knee pain gone. But when lower back pain is started, it was not there earlier. After your treatment, I got this pain. Now you have given me this pain. It was not there. Now you have to treat it. Okay. I came here for the good expectations, but I got new pain. So you have to explain. Pain is reaching to the original site because the pain problem in the lower back will reflect in the form of knee pain. Even the problem in the uterus will reflect in the form of knee pain. If the female has removed the uterus, there will be definitely knee pain. So that is because of the connections. We know the meridian is passing. So in this way, we have seen how to treat the medial knee pain. Spleen 9 or the 77.17, as per the Master Tung, this is called Heavenly Emperor. There are lower 3 emperor, we know, and this is the uppermost emperor, spleen 9. Then 44.06, then either SI1 or 11.09. These are the points for medial knee pain. We can see all the points together. Spleen 9, 44.06, SI1, and this is the 11.09. These are the points. Now the person is having medial knee pain and the medial ankle pain. Okay, medial knee pain, because in the Master Tung, there are multiple protocols, right? So now, I will tell you, the result will be very quick, very quick. Needle in, pain out. The person is having medial knee pain or the medial ankle pain. Again, I will remind you formula. If you want to treat the knee, you have to treat the heart. Now we are going to treat a wonderful point on the opposite side, that is called SI8. SI8 near the elbow. The other name of this point is Shanman. This is also the Shanman. The point, the other name is this point is hard gate. Hard gate, right? So I will explain you again because few people are new. Or definitely I have already explained to all the Master Tung participants. Now I will tell you the person is suffering with a knee in the medial side. Or with a knee pain, person is also having pain in the ankle. So we have to do the treatment on the opposite side. So first needle will be, we will insert the 44.09. And with that, we will be adding SI8. So look at the bone. We know this is the karate side, karate. From the karate side, there is a SI meridian is passing. From the junction of this pink and the black, this SI meridian is passing. SI meridian passing from the border of bone. So when SI meridian reaching on the reaching near the elbow, this point is called heart gate. Actually, this SI meridian has been divided in three parts: upper body, middle body, lower body. Upper body having connection with the heart and brain, middle body having connection with the liver, lower body having connection with the intestine. So because this is part having connection with the brain and heart, so we are having at this bone, just next to this bone, we are having heart gate. As soon as you put the point here, immediately knee pain will disappear in the friction of seconds. So this is one of the great points for knee pain, heart gate. And as the name, remember one thing, what is the name? Heart gate. If any person is getting any types of the angina pain, heart pain, emergency of the heart, you can insert this point. Immediately emergency will be taken care. Look at the point. We can see this bony part. And this is the location of SI meridian. From this bony part, we can't put the needle here because on the bone needle will not go. So we are going 2 finger up. We are going 2 finger up and we are putting the needle here. If the person is having pain in the left side, we can put the needle on the right side because it is the heart gate. If the person is having chest pain, immediately we can treat the chest pain. So we can put the needle on the border of. From the auricular process, we can go 2 finger up and we can put the needle here. You can see. So I am directing the needle upward. My needle is going in the muscle, the very big muscle here. If I direct the needle downward, it will not reach because it will stuck with the bone. I will put one more needle upward here for the support. So one needle, 2 finger up, one more needle adjacent to this needle here, just for supporting this needle, just next to this needle. You can see 2 needles. One of the great point, I have tried this point for too many patients. This is the point called heart gate. Immediate relief in the knee pain. Immediate. But the knee pain on the medial side. Medial side, right? Quick result. You can try. You can try this. Because this is coming in the lower arm, we have discussed more indication in our class. Remember, we have discussed many more other indication of this point. This point is having too much wonderful indications. What is the name? Heart gate. Any person is having any type of the heart problem, forget the problem, just put this point and just take your tea with full relaxation. There will not be any harm. Do not worry for anything. If the patient is having chest pain, just put this point and sit calmly. 100% this point will take care of the heart problem. Result are 100%. You put this point, many patients are having, doctor is telling, okay, you are having blockage in the heart, you are having problem in the heart, you have to do the surgery and all, right? You put this point. But definitely, if the person is having high blood pressure, then you have to work on the high blood pressure. In the previous master team class, we just discussed on the high blood pressure. There are multiple points of the high blood pressure. We have to treat the reason of the high blood pressure. But if you want to treat the heart, wonderful point. And knee pain, excellent point. Ankle pain, excellent point. Right? This is called Actually, I was not knowing this too much effectiveness of this point. Even I was telling you, I was doing one many years back, too many years back. I was doing one yoga course from Kaivalya Dham. So a few Chinese participants came there, and they became my friend. And by doing wrong yoga posture, I got neck sprain. Neck sprain. So Chinese participant, they were, whenever they find me, they keep on pressing this point. In the day, they have pressed 500 times, 500 times. And I got wonderful relief in the neck. I asked them, what is the name of this point? They told this is a very good point for heart, this is a very good point for neck, but they don't know, they were not knowing the name. Okay. And really, I got wonderful results in the just 24 hours in my neck sprain with the help of this point, right? So this is a very good point for the angina pain, for the heart pain, for the knee pain. And in the Master Tung previous class, if you remember, I have discussed for ABN of hip. Okay, but right now our focus is not ABN. Right now our focus is knee. Excellent point for the knee. You can try. If your points are right, then person is going to get wonderful results. You can put the needle in this way. On the side of the bone, just put the needle up. Remember one thing, if your needle is very near to bone, it will treat the knee bone. If it is a little away from the knee, then it means you are putting the needle on the muscle. Then it will treating the heart, because heart is made by muscle, and if you treat the muscle, and it will treat the knee. Excellent point. Please try this point. It's a wonderful point. Suppose if you're doing some camp, you're doing some camp, free camp. For the knee pain, you can treat all the patient with these points only. Every patient is going to get the results. Every patient. So this was the heart gate. Now the next is, that is called swelling of the knee. Next discussion of hydroarthrosis, when there is a water in the knee, swelling in the knee. Inflammation and swelling of the movable joints because of the excessive synovial fluid. We know inside the knee there is a synovial fluid. And sometimes it's very high, too much. Then person is getting inflammation. Then going to the doctor. Then doctor telling, okay, now we need to take the fluid out. We can just treat within few sittings. No need to take the fluid out. It's very easy to treat. Patient will get the result from first sitting onwards. So how to treat the swelling of the knee? Now we have to come on the back side, on the back soup point. So before showing this back soup point, I will show you some other image. Let's see this image. We already aware with the back soup points. We know urinary bladder 11, urinary bladder 12, urinary bladder 13. Urinary bladder 13 is the back soup point of lung. Urinary bladder 40 is the back soup point of pericardium. Urinary bladder 15 is the back soup point of heart. So 13, 14 and 15, these 3 points are the back soup point of chest cavity. Suppose I am treating these 3 points, 13, bladder 14 and bladder 15. So I am treating the lungs, I am treating the pericardium, I am treating the heart, I am treating entire chest cavity. If I am treating the entire chest cavity, means I'm treating the knee. But now this problem is very aggressive. There is a swelling. So if we see in the back side, there are two lines. One line is inner line of the UV. This is the inner line. One is the inner line of the UV. Inner line. And one is the outer line of the UV. This is the outer line. What is the difference? In the outer line also, at the level of bladder 13, we are having bladder 42. It will work on the lungs. At the level of bladder 14, there is a bladder 43. It will also work on the lungs. At the level of bladder 15, we are having bladder 44. It will also work on the lungs. Then what is the difference between inner UV line and the outer UV line? I will tell you. The outer UV line is doing lymphatic drainage. Lymphatic drainage. In the whole body, there is a lymphatic drainage happening. In the each and every organ, whether the heart or the lungs or the kidney, each and every organ, there are cleansing process happening. That is called lymphatic drainage. So when we want to do the lymphatic drainage of the knee, we will do the lymphatic drainage of the chest cavity by these 3 points. So what we can do, we can put the cup here. At the location of lung, pericardium and heart, we can put the cup here, we can do the cupping here, we can do the gua sha here, or we can do the bloodlet here. We can prick the point and do the bloodlet here. So as per the Master Tung, if someone is having swelling in the knee, so he used to take these 3 points. One point is at the level of lung, 1 point at the level of pericardium, 1 point at the level of heart, 3 point bladder 42, 43, 44. On the second line, so they are doing lymphatic drainage and they are doing bloodletting. They are pricking the point, taking out the few drops blood, maybe 1 drop, 2 drop blood. And the Master Tung has told these points are called DT07, DT7. 3 points unit, DT7. So DT07 or the 3 metal, the very good point if someone is having swelling in the knee. So first you do the bloodletting from here. Then you put lingu. The second point you have to put the lingu. Lingu we already discussed. So lingu, we have to do the lingu on the opposite side. And the third and last point, we will be putting lung tan. And 2 more points on the side of the lung tan. Right? Lung tan, these 3 point unit, 1 point on the lung tan, 1 point on the side of the lung tan. These 3 point unit is called 22.11. As per the Master Tung, it's very good for removing all types of spleen disharmony. Because as per the Master Tung, this entire area of the thumb is having connection with the spleen. And if I'm putting the needle on the 22.11, it will remove all types of the spleen disharmony. What I want to do, I want to remove the swelling. What is swelling? Swelling is gathering because of the spleen disharmony. So look at here now. So we know lung tan already we know. We can see here the junction of pink skin and the black skin. This is the junction here. We know lung meridian is going from here. Lung 9. Then the lung 10. So lung 10 is here. If you see my hand, then you can see lung 10 will be here. In this line, lung 10 will be the center point. So we'll take 2 more points on the both sides. So these 3 point unit called 22.11, wonderful for removing unwanted turbidity, dirtiness, swelling from the knee area. So 3 point for, and you will see results within 2 hours or less than 2 hours, or sometime just as you complete your treatment. 3 point bloodletting. How much blood? Few drops. It's not like a hijama. In the hijama, there too much blood we are taking out. In the master tongue, we are not taking out too much blood. We are taking out only little drops of blood, little drops, right? One drop also enough. Then second lingu, opposite side. If the person is having swelling, the right knee will take the lingu. And third, lung 10, 3 point. Now, whether we have to put all the 3 point? No, you can put 2 points. Even you can put 1 point out of 3. Done. You will see wonderful effect on the knee arthrosis. So let's see now. So hydroarthrosis, we are doing the cupping guasa or bloodlet here. Then we are putting the lingu point on the junction of first and the second metacarpal bone. Then we see there are the 3 point. The center point is lung 10. Out of 3 point, we can choose any 1 point. So 3 point combination is great for, means DT07 on the back side, lingu, and 22.11 means lung 10 combinations. It's wonderful for the knee arthrosis. Let's move to the osteoarthritis of the knee joint. We know this is a normal knee. And this is the degenerated knee. We can see. We can see the osteophytes and the degenerations. So how to treat the OA or knee? It's a very common condition with the age. So when we want to treat the osteoarthritis of the knee, we are putting 44.06 point on the opposite side. Then we are putting lingu point on the opposite side. This lingu point coming again and again, and lingu point is very much necessary for the osteoarthritis, right? Third, we will be putting lung 5 point. We know lung 5 in the master tongue, we are telling it 33.16. So 44.06, point number 1. Lingu will be point number 2. And lung 5 will be point number 3. 44.06 will be treating entire knee, improving the good circulation. Lingu will be treating all the nerves who is passing from the knee area. Lung 5 also is very good point, who is supplying the proper energy, proper chi, and with the old age, person is getting degeneration. Lung 5 is very good for that. So we have taken 22.05 or the lingu, 33.16 or the lung 5. We have to take all the point bilateral. Now the last point, we know this is the lower leg. In the center of the lower leg, we will do blood late, same side, where the knee pain is there. So 3 point on the opposite side and do the bloodlet on the same side, person will be getting immediate relief in the pain of the osteoarthritis. And we are not working on only on the pain, we are not doing just the pain management. We are also treating the knee pain, the root cause of the knee pain, right? So I will repeat once again. Person is having osteoarthritis of the knee, definitely 44.06 will be the point number 1. Then lingu, the point on the junction here, junction of this bone and this bone, junction here, this is the point, lingu. Even the person will feel very good. Then the last point will be lung 5, only 3 points. In the master tongue, 3.4 points are enough. Then we are going on the same side. If this knee is having arthritis, then we are measuring this total length. And whatever the middle, from here we will do little pricking and taking few drops of blood out, or we can put the cup, or we can do the cupping here. If it's not possible for you, we can do the guasa here on the same side. Remember always the bloodlet or the guasa we do the same side. So few more protocols are remaining, which will continue, we'll discuss in the tomorrow class of the master tongue. But I think this is enough for all the participants who joined today. And I hope you have learned many points and you will apply these points in your clinical practice. So thank you so much. But for other master tongue participants, we will be having continued discussion on the knee pain, and we will be discussing more point in the tomorrow class. So let's close the session. Thank you so much, everyone.